Hello and welcome to this student drug and alcohol awareness video. My name is Jonren Cabañero. I am from section 1B, BS Cream. This presentation is on drug and alcohol abuse and I hope it will be helpful to you. Student drug and alcohol awareness. The use of illegal drugs or the use of prescription or over-the-counter drugs for purposes other than those for which they are meant to be used or in excessive amounts. As you can see, that is my infographic about drug awareness. There are 35 million people worldwide suffer from drug use disorders. Why do people use drugs? To feel good, to feel better, to do better, to explore. To feel good. Stimulants may lead to feeling of power, self-confidence, and increased energy. To feel better. People may use substances to reduce social anxiety or stress. To do better. The increasing pressure to improve performance leads many people to use chemicals to get going to the next level. Or, in simple, to get high. To explore. Some people have a higher need for novelty and higher tolerance for risk. Use of illegal drugs or prescription or over-the-counter pharmaceuticals for purposes other than those for which they were prescribed or large quantities. Drug misuse can result in social, physical, emotional, and occupational issues includes cocaine, heroin, Adderall, methamphetamine, magic mushrooms, marijuana, ecstasy, and LSD, or lysergic acid diethylamide. Cocaine. Cocaine is a white powder that comes from the dried leaves and of the coca plant, which is found in South America. Crack cocaine is a form of drug that gives a very quick, intense high. An example of cocaine in the picture. What is the use of cocaine in our body? Cocaine accelerates your entire body. You may be energized, joyful, and enthusiastic. However, your mood may shift. You may become enraged, frightened, and fearful that some is after to you. You may do things that are illogical. You can crash and feel exhausted and melancholy for days after the cocaine high wears off. You have strong desire to use the substance again in order to feel better. Heroin. Heroin is a highly addictive drug derived from morphine, a psychoactive mind-altering chemical extracted from resin of opium poppy seed pod. The color and appearance of heroin are determined by how it's manufactured and what else it to be mixed with. As you can see in the picture, that is a sample of cocaine. I mean heroin. How heroin is used. Heroin is mixed with water and injected with a needle. It can also be sniffed, smoked, or snorted. With people who use heroin sometimes combined with other drugs such as alcohol or cocaine, which can be particularly dangerous and raise the risk of overdose. Many people died because of using of cocaine and heroin. Adderall. Adderall is a combination of amphetamine and dextroamphetamine, two central nervous stimulants that improve focus and reduce impulsivity by increasing dopamine and norepinephrine levels in the brain. Effects of Adderall in the body. For people diagnosed with attention deficit hyperactivity disorder or ADHD, Adderall helps to improve concentration and focus. As a central nervous system stimulant, it can also have the very same effects on people without ADHD. Methamphetamine hydrochloride, commonly known as shabu ice or meat, or it is any other name, also refers to the drug having such chemical composition, including any of its isomers or derivatives in any form. Effects of methamphetamine hydrochloride as a powerful stimulant. Methamphetamine, even at small doses, can increase wakefulness and physical activities and decrease appetite. Methamphetamine can also cause a variety of cardiovascular problems, including rapid heart rate, irregular heartbeat, and increased blood pressure. Magic mushrooms. Magic mushroom, also called shrooms or mushrooms, are a type of mushroom that contains the drug of psilocybin or psilocin. This drug causes hallucination. Psilocybin powder can also come in the capsule form. Effects of magic mushroom. The effects of magic mushroom usually begin in 30 minutes when eaten or within 5 minutes. During this time, the person may experience euphoria and well-being, change in consciousness, mood, thought, and perception, dilatation of pupils, perceptual changes such as visual and auditory hallucinations. Marijuana. Marijuana or cannabis embraces every kind, class, genus, or species of the plant Cannabis tabida, included but not limited to Cannabis americana. What the effect of marijuana in people? Marijuana is a drug used to cure such as related disease, but most people use marijuana to increase mental activity, relieve fatigue and alertness, and excessive or abuse of this drug may lead to tolerance, physical dependence, and also effects are depression. Hallucination sometimes may lead to coma and even death. The symptoms of too much use of marijuana. First, stomach discomfort. Second, headaches. Third, fast or irregular heartbeat. Fourth, increasing body temperature. Fifth, breathing quickly. Sixth, vomiting. And lastly, facial flushes or sweating and chills. Methylene diosphtamine or MDMA, known as ecstasy, or by its another name, also refers to the drug having such chemical composition, including any for its isomers or derivatives in any form. What are the effects of drug ecstasy? It is believed that many of the negative consequences of MDMA or ecstasy are the result of the destruction of serotonin-producing neurons in the brain. Serotonin is a brain chemical that plays an important role in regulating mood, aggressive behavior, sexual activity, sleep, and pain sensitivity. LSD or lysergic acid diethylamide, or known as LSD, is an illegal synthetic drug that combines natural and man-made substance. It is derived from ergot, a fungus that grows in certain grains, a non-organic chemical called diethylamide. Effects on perception. LSD can trigger a range of perceptual changes, often visual changes related to touch, mood changes, impacts on thinking. Alcohol. Alcohol is a psychoactive drug A psychoactive drug is any substance that crosses the blood-brain barrier, primarily affecting to the functioning of the brain, be altering mood, thinking, memory, motor control, or behavior. This is my infographic about alcohol awareness. As you can see, about 54% males drinking alcohol and 32% of females drinking alcohol. Two billion people worldwide consume alcohol drinks, which can have immediate and long-term consequences on health and social life. According to the gender differences in epidemiology of alcohol use and related harms in the United States, why people drink alcohol? People drink alcohol for many different reasons. However, some people drink alcohol more than others, and those who consume many alcohol drinks on a regular basis can develop a dependency alcohol use disorder. Why people drink alcohol? There are 5 reasons. First, social reasons: stress, peer pressure, family historic of alcoholism, mental health issues. Why social reasons? Some people consider themselves social drinkers as they consume alcohol in various social situations, happy hours, birthdays, parties, or other holidays. Stress. People drink alcohol because of stress, sometimes in work and or school works. Family history of alcoholism. The effects of alcohol are long-lasting and can take a toll on your health well beyond a hangover. People with a family historic of alcoholism have a genetic disposition and also develop alcoholism. Peer pressure. People drink alcohol because of peer pressure, sometimes in our friends or families or loved ones. And lastly, mental health issues. Alcohol can provide a mental escape from one's own mind, which why some people drink alcohol or may abuse alcohol in attempt to self-medicate or addiction. 5 treatment for alcohol addiction. 1 is behavior therapy. 2nd, biofeedback therapy. 3rd, holistic therapy. 4th, family therapy. And Alcoholics Anonymous. That's all. Thank you, and I hope you enjoy and you have learned from this awareness.